Well, I am honored to be here today. I am the First Lady of Atlanta, Sarah Elizabeth Reed, with Dr. John Lippman, really who is known as Atlanta's fibroid specialist, an interventional radiologist and fibroid specialist. I am excited to kick off the Don't Lose Your You campaign. And hopefully you'll tell me all about this campaign, the purpose of it. Thank you so much for being here, and let's get started.
Great. We're so thrilled to have you at the office and say it's such an important campaign, and I really appreciate your help.
Thank you. So can you tell me a little bit about, this is an issue that is extremely serious, really to me, because the numbers are shocking. How many women are diagnosed with fibroids, myself included, or know a woman who is? I feel like this issue touches all of us in some way.
It really does. Fibroids are the most common pelvic tumor seen in women. Now they're benign, they're not cancerous, which is important, but they can cause very significant symptoms in a percentage of patients. The most common symptom is heavy uterine bleeding, heavy menstrual periods. In fact, it's the most common reason why women have heavy periods.
Mm-hmm. And why is it so important to you to make sure that women know their options? I guess there's so many women that are told you must get this type of surgery, you must have a hysterectomy or a myomectomy. But this, it sounds like, is really another option that so many women don't know about.
Most women struggling with fibroids never hear about uterine fibroid embolization, UFE. It's also called uterine artery embolization, UAE. It's the same procedure. But most women never hear about that option. All they hear about is surgery. And so what the campaign is really focused on is so women can know all their options. If you're struggling with fibroid symptoms, it's important to know, yes, you could have an operation, but there is this outstanding outpatient non-surgical procedure, UFE, that will get you the relief of symptoms you're looking for. That's important. You'll avoid all the surgical risks and long recovery. And importantly, you get to keep your uterus, something that's really undervalued by a lot of physicians. There is an impact for women losing one's uterus. They may struggle psychologically, they may struggle sexually. There's a lot of sexual dysfunction after hysterectomy. We know that it changes a woman's bone chemistry, a lot of bone loss after hysterectomy. And now there's good evidence to suggest heart disease and heart risk is elevated, particularly if you have a hysterectomy less than age 50. And that's most women, because the average age of hysterectomy in this country is less than 40.
Wow.
And the most common reason is not cancer, which would be appropriate. It's these benign fibroid tumors. That's the most common reason why women are undergoing hysterectomy.
Wow.
And we want to say, you don't. You don't have to have a hysterectomy. You can choose it, but there's this non-surgical outpatient procedure, UFE, that you could do instead. Keep all your parts.
Wow. And I thank you so much for raising this awareness, because it's so important when women are facing these difficult decisions to know all of your options. So that if you choose hysterectomy, myomectomy, UFE, you are doing it from a place of knowledge and power, knowing all of your options.
Exactly.
So can you tell me a little bit more about specifically what is UFE, what happens and what is done, how do you eradicate the fibroids?
We gain entrance to the body through a little tiny nick in the skin at the top of the patient's right leg. That's our entrance into the body. And I can negotiate a little tiny catheter the size of a piece of spaghetti. Under X-ray guidance, I can guide it into each uterine artery. Each uterine artery branches like a tree, getting smaller and smaller branches till you get out to the leaves. The fibroids are the leaves of the tree. I know what size those tiny branches are, and I can flow direct particles that cut the blood supply off to every fibroid in the uterus. The trunk and the big branches, the uterus stays alive, but all of the fibroids are knocked out. And when they're devoid of blood supply, these fibroids will soften and shrink. And as they do, a woman's symptoms get dramatically better or disappear entirely.
Wow. I actually have a friend of mine that just recently, I think a day or two ago, had surgery, a myomectomy. And I think one of the main reasons she and her doctor elected to go with the myomectomy is because she really still wanted to have children. So how does the UFE process impact a woman's fertility and ability to then get pregnant after UFE?
Well, I wish we had all the information on fertility, but what I can tell you is both procedures, UFE and myomectomy, definitely impact a woman's fertility in a negative way to some degree.
Mm-hmm.
Now, it's our hope that we will show that UFE impacts it less than myomectomy. We know that myomectomy, cutting on the uterus, causes scarring, and scarring will diminish a woman's fertility. And so if she has a myomectomy, she will expect a diminished fertility. We know that as a fact.
Okay.
We think that there will be some diminished fertility with UFE also, but it's not in stone.
Mm-hmm.
I've seen lots of patients in my practice have children after. I've had 3 sets of twins born.
Wow.
And our births are typically full-term and vaginal deliveries, whereas if you have a myomectomy, you must have a C-section. You have no choice about that. But it's a murkier discussion. You have to talk with an interventional radiologist who's experienced in treating fibroids like myself. I would say in general, the younger the woman is and the fewer the fibroids, the more that myomectomy may be a role. The more numerous fibroids that a woman has and the older she is, the more she might want to look at UFE. But it's a discussion that takes a long time in the office. You have to look at each patient individually.
So it's a really case-by-case basis.
It really is.
And I guess I understand that fibroids impact 1 out of 3 women and up to 80% of African American women. Why is it so prevalent in the Black community? I have fibroids. Almost every woman I know has been impacted. Why is it so common among Black women?
2 main reasons. One, it runs stronger genetically in African American women's families. The other has to do with body fat. Estrogen, it's the one thing we do know, fibroids will grow with estrogen and progesterone. That's why they tend to grow really rapidly during pregnancy and why they tend not to be an issue for women once they reach menopause. Estrogen is stored in fat, so the more body fat a woman has on her, the more likely she's going to have bigger fibroids, more numerous fibroids that'll likely cause symptoms. Because you only want to treat with UFE patients that have symptomatic fibroids. So if you have fibroids and no symptoms, you don't need any treatment. But we want to educate people that have significant symptoms with fibroids. Not only do you have surgical options, but you have this UFE option.
A non-surgical option.
Non-surgical outpatient option.
And have you found that exercise and eating helps?
Absolutely does. Again, we do this anti-estrogen approach. We want to block estrogen every way we can. First, we talked about body fat, so exercise and weight loss, that will lower your estrogen. We want to encourage people to eat healthy. Fruits and vegetables, colored fruits and vegetables in particular, they have compounds called flavonoids. And flavonoids will block an important enzyme in producing estrogen. So it's another reason to eat your fruits and vegetables, particularly colored ones, because that's going to be important. There's also, people are looking at hair relaxers. It's a common thing that's used in African American women. One of the main components of hair relaxers is actually a compound very similar to estrogen.
Wow, that's so interesting, right? Perms and straighteners. I have a 3-year-old daughter, so I wish she was here to hear about all of the factors that play an impact in your health. Like I always tell her, of course, eating healthy and eating green and colorful vegetables and foods. So I wish she was here to listen and hear this.
Well, it's a very important thing, and I'm glad you brought that up, because one of the things that we found is that women are not talking to each other. We need to increase the conversation, mother-daughter conversation like you mentioned, but also friend conversations between women. I'll typically hear from patients saying, I didn't even know. My sister had fibroid surgery. She didn't even tell me.
Wow.
I didn't know she was struggling with fibroids. My mom, I guess she had a hysterectomy. It was probably fibroids, and then I was struggling with it, and she came clean. Yes, it was fibroids. And it's an embarrassing topic. You're bleeding heavily. You may be soiling clothes and linens and not be able to work a couple days a month. It causes oftentimes profound anemia. They're tired, they're weak.
Yeah, it's a difficult thing to talk about.
And so you keep it to yourself, almost like you think you're the only one going through it.
But that's not true at all.
It's not true at all. It's so prevalent, it's so common, and I hope people will start to increase this conversation. One of the things about the Fibroid Alliance is we want to get a lot of people that are, energized by this and influencers, and we really will share this on social media. We want to get it out there. We want people to know that they have options. We don't want to hear about the silent sufferers, these women. There's over 1 million women in the United States sitting on the sidelines. They're suffering with the heavy periods. They're patting themselves up. They don't want surgery. It's the only option they've been given. They don't want that, but they don't know of any other option. So they just kind of suffer with this. And it is truly suffering. I mean, you may say they may not work a couple days a month. They have to know where every bathroom is. They will often carry gear with them wherever they go, extra clothes, extra, pads and that kind of stuff. It's miserable.
Right, and it's painful. The Fibroid Alliance is really a campaign and a group of women and men who care and want to raise awareness. And is the hashtag on social media just hashtag Fibroid Alliance?
Well, that's certainly one of the tags, but we're also going to add another tag. Don't lose your you.
Awesome.
And
so don't you lose your capital U.
Correct. You being uterus, obviously, but it's also a play on words. It's also Y-O-U. Because that's yourself, your womanness.
Right.
The uterus is the epicenter of your womanness, and you don't have to lose that. In fact, I think you would prefer not to lose it because it has profound changes in women, and we're hoping that they don't have to lose your you. You can have UFE, get the relief of symptoms, get your life back. It truly is transformational. I mean, when you're operating on such a low tank, you're tired, you're weak, you're anemic, and then you have the UFE procedure, you truly get your life back. Some women think that, it's just, they're supposed to get tired with age. It's like, oh, I thought I was getting older, yes, I'm more tired, I'm weak, and I just thought that came with age. No, age is a number. You're operating on a low tank, and once we bring them back to the full tank, it's like a rocket boost. They can't believe how great they feel. It's like, I should have done this years ago.
Well, thank you for doing all that you're doing. You're passionate and you're helping women refuel their tanks and really understand that sometimes your doctor may tell you about a hysterectomy, a myomectomy, but there is another option, this UFE. So thank you for all that you're doing for this campaign. I'm excited to become part of the Fibroid Alliance. As I said, I was diagnosed with fibroids, and I guess I was blessed because I didn't have to have surgery. I was able to successfully get pregnant, and they weren't an issue. But I really was intentional about changing my diet, trying to exercise more. So I'm nervous as I get older, but I'm trying to stay on the right track of exercising and eating properly. But I'm part of the Fibroid Alliance.
We're thrilled to have you, and I'm glad you're doing all the right things. It sounds great. And we look forward to working together in the future.
Thank you. Thank you for being here, and I'm excited to talk with Cynthia Bailey, who is your Fibroid Awareness Ambassador.
Yes, she's our celebrity fibroid ambassador, and she was obviously a patient, and she talked about it on The Real Housewives of Atlanta, and she's been very passionate about how fibroids impacted her life, and then she found UFE and got her life back, got her sexy back, which is great, and she's doing wonderful. And as she says, I didn't have time to be down. I had an empire to create, and she feels wonderful and looks great, and we're thrilled to have her as well.
I think there may be a little confusion between everyone, because who's not a doctor or a radiologist, between ablation and embolization. Can you kind of help explain that?
Sure. Ablation is when you destroy the lining of the uterus. It's a gynecologic procedure. It's usually done with heat, either hot boiling water, radio frequency, microwave. Some form of energy is placed to burn the lining of the uterus. In some places they will cryoablate, meaning they freeze the lining, but it's to destroy the thin lining that sheds every month. If a woman has heavy periods and is not interested in fertility, ablation is okay as long as the bleeding is not due to fibroids. So if you're having heavy periods, it's not due to fibroids, and you're not interested in children, ablation is okay. The problem becomes if you have heavy periods and you do have fibroids that are the problem, the ablation does nothing to the fibroid. The problem is no longer the lining. The problem is the fibroid. Because the fibroid will often cause not only heavy bleeding symptoms, it'll cause bulk-related symptoms, pelvic pain, back pain, urinary frequency, painful intercourse, even constipation. These tumors, depending on where they're found in the uterus, will press on whatever's next to them. So the ones that are near the lining cause the heavy bleeding, the ones near the bladder cause urinary frequency, out laterally pelvic pain. So if your symptoms are due to fibroids, ablation is not the procedure for you.
Okay, because that's burning the lining.
That's just treating the lining. And even if it's fibroid-related bleeding, the fibroid needs to be treated. Trying to burn the lining in a fibroid-related bleeding case is likely not going to help at all.
And okay, now I have kind of a personal question. If someone was diagnosed with fibroids and then gets pregnant, what is the pregnancy's impact on the fibroids? I'm just wondering kind of what happened to mine.
Well, most fibroids will grow during a pregnancy, but most women with fibroids during their pregnancy will have totally fine, uneventful pregnancies. The fibroids may grow, likely to grow, but likely not impact the fetus in any way. Now, they certainly will watch with ultrasounds, but likely in most instances, the fibroid won't present a problem. The flip side is, could the fibroid prevent a woman from having a child? You bet. It can impact any part of the fertility pathway. It can prevent her from having a child. It can cause a miscarriage. It can cause a termination. It can prevent a woman from having a vaginal birth. Any part from conception to delivery can be impacted by fibroids, but fortunately for most women, that's not going to be an issue.
Okay. And then, so after a woman like myself successfully has a child vaginally, then do the fibroids, are they more likely after the pregnancy to come back or to decrease and get smaller? Or?
They will kind of grow rapidly, tend to grow during the kind of surges of estrogen during the pregnancy, and after pregnancy, they'll actually start to shrink a little bit. But if you watch their growth like in a curve, they won't go back to where they were at the beginning. So they'll grow and then they'll come back a bit, but not to where they were before you got pregnant.
Okay.
So over time, as you'll see if you develop any symptoms or not. You know what symptoms to look out for. But most women will not develop symptoms. They'll have these fibroids. We call them passengers. They kind of ride along in the uterus. They're not bothering the woman. So if you have fibroids and no symptoms, no treatment. But once you start developing symptoms, then you're going to start to think, okay, what are my treatment options available at that time?
And so I have fibroids but have no symptoms, so I guess I should continue to just exercise and eat healthy, and hopefully I remain.
Correct. That's the best thing you can do. You're doing all the right things. I wish you were, the norm, you're the exception. And that's why we're trying to educate patients to try to be as fit and healthy and eat healthy as they can, because then you really have the best control of your fibroids. You can't do anything about the genetic stuff, at least not currently, but you can control what you eat and how often you exercise and keeping any excess body fat off you, because it'll not only be good for your fibroid health, it'll be good for your overall cardiovascular health. And so it's a double victory.
Well, thank you so very much. This has been so educational for me and so inspiring, just because so many women will be touched and will know I have another option, this UFE that probably most people have never heard of, but now we're raising awareness so that people know you don't have to suffer in silence. So thank you so much.
Thank you. Information is power. And I really appreciate your help with this, because we are going to try to touch as many women as possible to start educating them. The more options you have, the better it is.
Right. Thank you.
Thank you.
So I've had a lot of girlfriends who feel that after they're done having children, the uterus is not necessarily necessary anymore. Can you kind of help me understand, why is the uterus so valuable? Of course, we know for producing life, but beyond having kids, why is it important to keep your uterus?
Well, it's very important, and it's so undervalued by physicians. It's really striking to me. Most gynecologists will tell patients suffering with fibroids that are not interested in children to have a hysterectomy as if there is no consequence to losing your uterus. And that's just not so. The uterus is very important for women. It's the epicenter of their womanness. There are a number of women that struggle psychologically after losing their uterus, like a man being castrated. There's a lot of sexual dysfunction after hysterectomy. Again, it's very embarrassing. People don't like to talk about it, and they kind of keep that to themselves. We know that the uterus is important in bone health. Women who have hysterectomies have a much higher incidence of osteoporosis that can lead to major disability, fractures of bones, and African American women already typically have low vitamin D values. It has to do with the pigment in the skin and how we get vitamin D into our body. You add on top of that loss of calcium and bone stock from a hysterectomy, you really put them at risk for a fracture. And now we know that it's important in heart health. Women who have hysterectomies, particularly less than age 50, have a much higher incidence of heart disease, heart attack risk, stroke. And these are young women because the average age of hysterectomy in this country is less than 40. So many women are having hysterectomies less than 40, even less than 30. And we want to change that.
Right. And we hear families that say, women who say, my sister had a hysterectomy, and my mother, and my grandmother, and my aunt. So it's very common. It's shocking.
It's way too common. Hysterectomy is the second most common surgery we do in the United States, yet half the population, men, aren't even eligible. And the number one reason why we do hysterectomy in this country are for these benign fibroid tumors. And we want to end that. We don't want to do hysterectomies for fibroids any longer. These women are far too young. They need their uterus. It's important. And we want to educate them that they have these non-surgical options like UFE, and they don't have to lose their U. It's really important.
Thank you for helping us as women maintain our souls and not lose our you. So thank you so very much. This is exciting, and I'm ready for the Fibroid Alliance to start a movement.
Excellent.
Thank you.